Hi, I'm Dr. Katie Berlin.
And I'm Dr. Alyssa Watson.
Thanks for joining us in the Veterinary Breakroom. This is where we have shorter conversations about relevant issues in vet med and the world. And disclaimer, we are two general practitioners. We are not subject matter experts the way that our specialists are, but we are out there in the trenches too. And so we are talking about some topics that just are going to affect all of us in some way, whether it's directly or affecting our colleagues and the profession as a whole. So today, we're going to be talking about a recent development in Georgia. As of July 1st, the poison control hotlines are suspending service in Georgia for pet owners. So veterinarians can still call in to like the ASPCA poison control hotline and the Pet Poison Helpline, but for consultations, but clients cannot do that. And the reason is because there's some new legislation in Georgia affecting the rules for tele-triage and who can provide that. And there's some controversy right now over whether poison control hotlines are included in those tele-triage restrictions. So that's basically what we're talking about, because I know I have used the poison control hotlines a lot in my career. And Alyssa, I'm betting you have too.
Oh, absolutely. And, I think it's really important too. There are, when we're talking about poison cases, you're talking about things where time is really critical. And so we definitely have had people call in and we say, call the poison control hotline right now, get a case started, get that number, get in the car. When you get here, then I can go back in, you'll already have a case up and I can consult with the veterinarian at the hotline. And it sounds like that's not going to be available to pet owners in Georgia right now. And I know if that was suddenly taken away from me, it would really affect how I practice. So there's certainly, I think, when we were reading about this and looking into it, they had said that the Georgia VMA was actually really in favor of this law, and they had kind of assured all the veterinarians as well as the people who run these hotlines that this law was not going to affect them. But then my understanding is after the law took effect, the hotlines are the ones that were worried about liability, and so they have voluntarily pulled back. Was that your understanding?
Yeah, that was my understanding also. And it's worth noting that today, the day that we're recording this, I think the Georgia State Veterinary Board is actually meeting, and this may be one of the things that they discuss. I would imagine it would be, because this would be really important to me there. But so it may be that this evolves. So keep an eye on the headlines for changes here, because especially if you practice in Georgia. But I think it's a red flag for any of us, given that telemedicine laws are changing so much. I know some states like Ohio just recently rolled back its requirements for like the in-person VCPR, and other states are cracking down and getting more strict about VCPR requirements. Those laws are changing all the time. Now, this is not that issue, because teletriage in Georgia, at least, doesn't require a VCPR at all. Teletriage is like general advice given virtually or on the phone versus like prescribing, diagnosing, treating a patient. So you can say, for this amount of toxin ingestion, this is the recommended treatment, versus prescribing drugs for a patient or something like that. And so teletriage is slightly different from telemedicine, the way that many of us understand it. But there are still considerations here for who's allowed to provide this service and to whom. And one of the restrictions is that veterinarians in Georgia now, to provide teletriage to patients, have to be licensed in Georgia, which is really tough when you have a national helpline who may not have any veterinarians licensed in Georgia. And I think I saw in the VIN article about this that I think the ASPCA hotline had one veterinarian on staff. They have like 55 vets or something who consoled,
Hmm.
but they only had one who was licensed in Georgia. And like, is that person supposed to just be constantly available for patients in Georgia when they ingest a poison? Like, that's not possible. So
Yep.
it just isn't very realistic unless you have a state-run helpline. But there are also other considerations besides the licensing, that there are conditions that have to be met in order for teletriage to be provided.
Yeah. And I think, they were talking about between the two hotlines, one of them, handled as many as 19 calls a day from Georgia. The other one handled, around 10. So we're talking about a significant amount of pets that are going to be affected by this. And I think
Yeah.
the other thing, too, to realize is that, we have so much going on in our daily lives and in practice and everything. And then to try to keep track of things like laws and regulations, which seem like they're kind of outside of our realm, and we don't really have to think about that, somebody else is going through all that. It's just kind of a reminder, that anytime laws or regulations change, they might have unintended consequences, or there might be something that actually affects you. And so that's why, even though this isn't going on in my state, it's still something really important to keep track of.
Yeah. We talk about this sometimes when it comes to like compounding medications. We were talking about that earlier today,
Hmm.
where compounding laws can also be hard to keep up with, and they're like extremely boring and complicated to read sometimes. At least for me, I could say that because our pharmacist isn't on the call with us this time. But but I just think they're really hard. Like my brain just checks out when I read about certain things, and compounding is one of them. And like when they're passing new legislation on things like telemedicine, that also kind of floats over my head sometimes, unless I really make an effort, because I don't do telemedicine as I understand the laws usually talking about it. But eventually, these laws are going to affect us in one way or another. And so if Georgia is having this issue, it's kind of a canary in a coal mine situation to me, that this is going to be a problem in other states too, as these laws sort of continue to evolve. And the poison control hotlines, who knows, in 5 years they may be a chat bot. So I don't know what's gonna change in the near future. Things have changed so quickly, but
Hmm.
I do feel like um, this is a consideration that never would have occurred to me when we've been sort of involved in all of these telemedicine, teletriage debates.
Get the fast results your canine patients deserve. Think fast. Think Apoquel, oclacitinib tablet for allergic itch relief starting in as little as 4 hours. Visit apoquel.com for full prescribing information and to learn more. May cause worsening of existing parasitic skin infestations, serious infections, or pre-existing cancers. New neoplasias have been observed. Do not use in dogs under 12 months of age with serious infections or in breeding, pregnant, or lactating dogs. Think fast. Think Apoquel.
The conditions that, just for anyone who's curious, the conditions that have to be met in order for teletriage to be provided in Georgia, and I'm going to read these off so they're accurate. There have to be three conditions met. One is, in order for teletriage to be allowed, no licensed veterinarian or vet tech is available within a 50-mile radius. So if you have an ER within 50 miles of you at 3 o'clock in the morning, teletriage is supposedly not an option. Um, Number two is, with the understanding that the client will present the animal patient for a physical exam at a veterinary facility as soon as reasonably practical, which in this case would be over 50 miles away. um, and then that they inform the client, so the provider, the teletriage provider, must inform the client in writing of their full name, location, license number, licensure status, and limitations involved in accessing veterinary teletriage, and obtain a signed and dated statement from the client indicating receipt of such required information. Now, I cannot imagine this happening over a poison control call where the owner is freaking out, because
Hmm.
I've been that owner, when their pet ingested something horrible and they're saying, like, we've got to induce vomiting immediately, or like get to a vet clinic immediately. But like, wait, let's take
But
20
first, yeah.
minutes and
Here's
do
my
all this
name.
paperwork.
Here's my,
Yeah.
yeah.
Yep. No, there's two L's. It's like, give me a break. Like, I feel like that is just really hard. And still, these three conditions, like, they don't really answer the question of whether a poison control helpline is tele-triage or not. And so that's what the debate is about. Like, these three conditions aren't changing as of now. The state board can't change these, but the question is whether poison control helplines are included in what is considered tele-triage.
Exactly. It comes down to interpreting what that actually means, and there's other things in those conditions too. Like, you're going to present in an amount of time that's reasonable or practical or considered practical. Well, what does that even mean? And who decides what is practical, so I think it comes down to, and that's another thing whenever, new regulations or laws are passed, then the interpretation starts to become, what we're actually talking about. Okay, this is what the regulation says, this is what the law says, but practically, how do we interpret that? So lots to think about. Certainly lots coming. Like you said, Katie, they're probably, I would be very surprised if they did not talk about this in their regular meeting. So, be on the lookout for more information on this.
I don't, just because it's relatable and it's making little core memories pop up in my head, like this whole thing about poison control. Do you have any like specific cases that you're remembering now where you were like, God, get that client to get a case number, and then you could pick up where you left off because you were like crazy busy or something like that? Because I definitely can think of a few.
Yeah, absolutely. I'm trying to think of some of my favorite, well, I don't know if you call them favorite toxicology.
Yeah, the ones that stick out.
But I have this, the one that completely sticks out to me is this. It was very early in my career, and it was a dog that ate its like entire bottle of phenobarbital, and it came in so drowsy and loopy, and we were trying to give it the activated charcoal, and we ended up having to, it was a whole process. We ended up having to do like gastric lavage and everything because we were going to go to try to give the charcoal, and he fell asleep in the bowl. But absolutely, like these, like I said, time is really of the essence. And so, that's something where I can see how this, this really affects how you practice.
Yeah, my case that I was thinking of was a dog that I believe was boarding with us for the day for some reason. Like, we had hospitalized him for something else. And the owner calls in a panic. Is like, I just found my whole thing of sugar-free gum, like chewed and empty. And we were like, oh my God, what kind of gum is it? And she's like, I think it was this kind, but it was like all chewed, And I'm like, call poison control, because I was, we had hospitalized patients, we had people in surgery, we had a probably short staff situation, and I had a full day of appointments, and I was just running, and I was like, I need her, like, get the process started, and then we'll figure out what to do, Well, went through the whole thing. She like called them. It was this whole thing. We did a whole bunch of stuff, and then later found out that it was, they discovered what kind of gum it was, and it was a gum that does not have xylitol in it. So we had spent the entire day like freaking out about this dog, and the dog was fine. It had fresh breath, So probably not great to eat a whole thing of gum, but there was no xylitol in it. But I was very grateful then, and many times also for the people at Poison Control. So I hope they get this fixed up, because it would really be a shame for pet owners and vet teams not to have this as a resource for clients to call directly. And just for the record, because I was curious, I did ask 2 different AI search engines whether they knew of any cases where like poison control helplines had lawsuits because of accusations of malpractice or something like that, where, the big concern is like, are you practicing veterinary medicine, and are you able to do it effectively, or like, are you overreaching? And they did not find any. So ChatGPT and Gemini both said, we don't know of any specific lawsuits, which is the opposite of making up lawsuits, which I've heard that they do. So, so I would like to trust that, but just to decide.
Yeah. Well, that brings us to, I think, our win of the week. Although we could just I want to say my phenobarbital dog actually did recover and did great. So
That's a good win.
It's a win of I don't know. It was early in my career, so win of the last 20 years. I don't know.
Right. Yeah, that dog did not eat xylitol, so also a win.
Great.
Yay! This is one of those times when we remember cases that did not go badly.
Yeah, exactly. That is a win. That is a win, to reminisce on some of our cases that went really well.
Yeah. Well, thank you all for listening to this short and sweet conversation, but I think this is important just to keep an eye on and just sort of keep mental track of, because this is going to be an issue that we see come up over and over, I bet. Just where the line is, where the breaches are. And ultimately, the big question is, how much can we trust practitioners to practice judiciously and make good decisions when they can't see the patient? And I think we all have some pretty strong opinions on that. So thanks again. We'll catch you next time in the break room.
Yep. Bye, everybody.
Thank you for joining us in the Veterinary Break Room. If you enjoyed today's episode, you can find us wherever you listen to your favorite podcasts, including a video version on YouTube. While you're there, make sure you subscribe, rate, and review. You can also listen to or watch our podcast episodes on our website at cliniciansbrief.com/podcasts, or drop us a line at podcasts@instinct.vet. Veterinary Break Room is an Instinct Science production, produced by Alexis, Ussery, and co-hosted by Alyssa Watson, Beth Mollison, and Katie Berlin.